So in the first segment, Sharon and I were talking about the uses of the trust for folks who need to qualify for some kind of benefits for Medicaid, typically. We're going to talk a little bit more in detail about that. Let's give us some examples of how Medicaid can help people who are living at home or in assisted living. So Sharon, why don't you give us an example or two of that situation?
Okay, great. So let's take our hat off for the long-term care, Medicaid, that a lot of people think about for nursing home.
Okay.
Now we're talking about people that live in their homes. My first example is going to be for a couple that we met in Jacksonville.
Okay. Oh, so you do the whole state?
We do.
The whole state?
Yes.
Oh, we didn't even talk about that. Awesome. Okay.
We cover the whole state. So I went up and visited with this couple. And they had been referred to us because their insurance specialists saw that they were paying a lot of money in medications every month.
Just in medications?
Just in medications.
Okay.
So it turns out that this couple, both of them are diabetic. They had gone into the donut hole, which means they're on Medicare, and all of a sudden their copays for their insulin went way up to $360 a month.
For each of them?
For each of them.
Oh, wow. That's a lot.
So they were basically not paying for their insulin. They were choosing between food and their medications when I met them. So we opened 2 trusts, one for each of them.
Oh.
They were over the financial limits for Medicaid by about $1,000.
Per month or?
Per month.
Okay.
Right.
All right.
So they started transferring about $1,000 to the 2 trusts each month, and with that money we started paying their bills, rent, utilities, their car payments, things like that. Okay. So once we did that, it reduced their countable income for Medicaid purposes. We got them under the limit for the program.
The Medicaid program.
For the Medicaid program.
Okay.
The program I'm talking about is called QMB. It stands for Qualified Medicare Beneficiary.
QMB.
QMB.
Okay.
So once they got qualified for the program, Medicare paid their Part B premium for them. Their Social Security checks actually went up by $105 each.
So $200 and some just with that.
Right.
Wow.
Right.
Wow.
That covered our fee because we do charge $100 a month for these types of accounts.
Oh, that's right. We didn't talk about that. Okay.
Right.
All right.
So it's an offset. We don't want to be out of pocket to our clients.
Great.
Okay? They can't afford any out-of-pocket expenses. The whole point is to reduce expenses. So once they got qualified, their Part B started being paid. Their insulin went down to $3.60
each.
Each.
From 360 some.
Right.
Each.
Right. So
huge income improvement.
Huge.
Wow.
And a huge health issue too, because now they could take their insulin.
They're taking their medication.
Right.
Okay.
Exactly.
All right. That's a really good example.
Really wonderful.
Okay. All right. So then we've got another one. You mentioned a gal by the name of Donna. So she has complex medical issues.
Yes.
All right. So let's talk about her a little bit.
Donna came into our office right here, and she was in tears. Her doctors had told her that she could not come back. She couldn't afford her copays.
Couldn't go back to see the physician.
She couldn't go back to see the specialist that she needed to go see.
Okay.
So we got Donna on the QMB program. It's a Medicare and Medicaid combination. One of the advantages of it is it not only reduces medication costs, but it now covered her copays. So as long as she stayed within the network of doctors that accepted her Medicare, Medicaid, she could go to any doctor and she did not have to pay a copay.
And those are becoming a big problem now. They're not, copays are pretty high for lots of folks.
When you're on an Advantage plan, some Advantage plans charge $25, $35, even $50 when you go to the specialist.
Each time.
And when you're living on a fixed income, that is a lot of money.
That's a lot.
And when you end up in the hospital, you end up owing a bill a lot of times for all the daily copays and things. Well, Donna was in debt, and she just could not afford it. So
one of the reasons that I love this particular concept is that it works within the whole gamut of care. It works in a home environment, a residential home. It works in an assisted living environment. It works in a nursing home environment. And it works in a hospital environment. So my favorite thing about it is its flexibility. I always have this joke which says we can't read the tea leaves. We don't know what's coming. We don't know what's going to happen. So the ability to be able to be prepared if, say, something terrible happens and you fall and there's a broken hip and then there's a hospital stay and then a rehab stay and then possibly back to an assisted living facility and then back home. This particular solution works within all those programs, which is why it's something that I love to be able to use.
Okay.
So Sharon, let's go back to talking about some more examples. How about for someone who lives in an assisted living facility? How could Aged help?
Okay. So I'm going to give you an example of Mary, our client, who came to us with $20,000. Now, she'd been to see an attorney first, and the attorney said, I think a pooled trust would help you, Mary, because, you know, right now we can't get you long-term care, but we can help you reduce your medication cost so it can help you afford your assisted living payment.
Okay.
She was paying about $3,000 to her assisted living, and that was her income. So she was digging into her savings every month of about $800 or so to pay for her medications and her co-pays. She had a supplemental insurance policy. All of that was adding up. And so her $20,000 was only going to last a few years. Mm-hmm. So we got Mary on the QMB program, Medicare, Medicaid.
Okay.
And what it did was it eliminated her co-pays. And she didn't have to pay her Part B premium anymore. She didn't have to pay, or the medication costs went way down.
Okay.
So her deficit of $800 a month went down to about $100 a month. Right?
Wow, that'll really extend
her money. So that really extended the life of her money by many, many years.
Great.
Maybe up to 10 years.
Great.
So it's really all about extending the life of the money when you're using the trust to qualify for these extra benefits.
Boy, age is really helpful.